Many public health experts recommend changing the way we measure the severity of COVID-19 surges. They say these days it makes a lot more sense to focus on how many people are being hospitalized for COVID instead of paying so much attention to how many people merely have it. This discussion began in earnest following alarming media reports after a number of government officials tested positive, including 82-year-old Speaker Nancy Pelosi, who was pictured kissing 77-year-old President Biden. Then information indicated the media blast was a bit overblown, as those infected had only mild or asymptomatic cases. Medical experts also pointed out that after 2 years of COVID, most Americans now enjoy some level of immunity from vaccination, past infection, or both.
Nancy Pelosi, for example, they're tested maybe even on a daily basis, and those tests are reported out.
EVMS public health expert Dr. Brian Martin says while reported cases are sharply increasing, the true number is likely much higher. The big takeaway? Today's infections are generally mild. Many may even mistake COVID for springtime allergies.
There's a lot of home test kits, so none of that gets reported. If you do a home test, you don't call your local health department and say, hey, I tested positive for COVID, so that they now have that case. There are also asymptomatic people in the community that are positive for COVID and don't know it.
While paying attention to rising case numbers made sense in the early days of the pandemic, focusing on infections alone can now be misleading, making the threat appear worse than it really is. For example, after cases shot up 50% in just 2 weeks, colleges from coast to coast brought back mask mandates, including American University in Washington, D.C.
I would say kind of a comforting feeling that they were back, but almost like too little too late since our cases had already spiked.
Hospitalizations, however, rose only 4% nationwide in the same time frame. Even the new White House COVID response coordinator says while the overall number of infections remains relevant, it's really the number of serious ones that more accurately reflects the true risk we face.
We should look at cases. It should be one of the factors. But we should also be looking at hospitalizations, obviously, because that matters more. And then we should be looking at hospital capacity.
Thankfully, hospitalizations are at the lowest level we've seen since the pandemic began. Medical experts have reason to believe the number will remain low because in addition to a higher level of immunity, new treatments are becoming more widely available, and vaccines are being developed to specifically target new variants. Lorie Johnson, CBN News.